Today we continue to tell about physiology of blood. On previous lecture, I told you about main properties and structure of blood. And today we will continue. I told you about formed elements of blood, their functions, their components, blood group, and clotting of blood. So first of all, blood cells, real blood cells, it's leukocytes. Only these formed elements have nucleus, can grow, can divide, and this is actually cells. And leukocytes realized immunic function, and normal value in nowadays in range between 4 and 10 power 9 per liter. Actually, this range may vary, and with time you may find normal values slightly decreased. It means that immunic system in all persons decreased the efficiency, and it may lead to more frequent inflammations, viruses, COVID diseases, and so on. In general, we have different types of white blood cells. They divide on granulocytes, which have some small spheres, granules with enzymes in cytoplasm. Depend from color of these granules. They named basophils, neutrophils, and eosinophils. Main cells, it's neutrophils. They have most amount up to 70% from all white blood cells. And our second group are granulocytes, cells which have no granules. You may find there is no spheres in cytoplasm. And we divide on two types, it's lymphocytes and monocytes. They have less amount, but normal ranges. Again, you may find on this slide for every type of cell, normal percent range, they named leukogram. And in clinic, we usually comparing percentage of different types of white blood cells with normal ranges, and it's highly important for checking how our immunic system resistant to different types of pathological agents and type of response. It may be different kinds of response in acute, in chronic diseases, in virus and bacterial diseases, but I told you about this a bit later. First of all, you should know specific terms which demonstrate for other persons that you are a doctor. If you can manipulate with specific terms, it's good for you. And terms associated with white blood cells you may find on this slide. It's leukocytosis, leukopenia. It's two states with increased and decreased total amount of white blood cells. And we have specific terms for different changes in leukogram, in percentage of subtypes in white blood cells. For example, most frequent neutrophil cells, if total amount increased and became more than normal, more than 70%, we may tell about neutrophilia, increased amount of neutrophils. Decreased amount of neutrophils if there is less than 40%, we may tell about neutropenia. So suffix philia, it means increased amount, penia, decreased amount. And same rules we may use with all kinds of cells. For example, basophilia, increased amount of basophils, eosinopenia, decreased amount of eosinophilic cells, and so on. And now we'll find most valuable properties for different types of white blood cells. You know, and previously I told you, all white blood cells have immunic function and they realized immunic response, but every subtype of white blood cells have some properties, some specificity, and you should know this specificity. And we start find this specificity from neutrophils, because it's most frequent type of white blood cells. They have many neutrophilic granules in cytoplasm. Usually these granules, its lysosomes, they realized and producing enzymes which may dissolve, destroy proteins, and with help of these granules, neutrophils can destroy other cells, especially bacterial cells. That's why neutrophils, it's main type of white blood cells which resist from bacterial invasions. And when we find neutrophils find in blood some bacterials, neutrophils catch these bacterials, they realized phagocytosis. Phagocytosis, it's eating of other cells, bacterial cells. And after phagocytosis happen, enzymes from vesicles place to bacterial cell membrane and destroy this bacterial cell membrane. As a result, bacteria will completely destroy it. Usually, neutrophils, its main cells for response to bacterial invasion. This response have specific times, because if invasion happened in only one place, for example, after infection in skin, some bacteria came to the blood from one place on surface in our body. For migration neutrophils with blood to area where bacterial invasion happened, we need time. And usually this increasing amount of neutrophils takes several hours, and after 6 hours increasing concentration of neutrophils in area of invasion. And only after 24 hours we may find peak of neutrophils, highest concentration during second day after invasion happened. And during this time, neutrophils completely destroy all bacteria. Again, they require some time for these reactions. That's why we may say about a specific period for clear of our body from invasions. And only after 2 or 3 days we may check up, and if neutrophils completely destroy bacteria, inflammation will stop, and if amount of bacteria is very high and neutrophils could not catch and destroy all these bacteria, it may lead to injury and inflammation in many organs. From blood, bacteria may come to lungs, to heart, to many regions, and in this case we may find general inflammation or sepsis. Usually neutrophils start the activity after some additional factors like tumor necrosis factor, inflammation factor, some kinins, interleukins. Many these factors produced in area of bacteria invasion by monocytes. That's why usually white blood cells work together, and signals which came from monocytes are realized into protein molecules, interleukins, tumor necrosis factors, and so on. These factors traveling with blood and activate all neutrophils. Neutrophils start traveling in a region from which tumor necrosis and interleukin factors came, find bacteria and start phagocytosis. This process, named activation of neutrophils, this activation realized, as I say, with additional factors. Side effect of neutrophil activation may be production of thrombs, clotting, for stop traveling of bacteria, and prevent sepsis, prevent inflammation in many other regions. When it's very high concentration of bacteria, coagulation start by neutrophils may lead to many bad effects like necrosis in many organs. But it's a way for stop generalization of inflammation, and with help of this coagulation clotting mechanism, neutrophils try to prevent dissociation of all bacteria in our blood. Next type of white blood cells, basophils, and this is mostly regulatory cells. The normal value in blood is very small, less than 1% from all white blood cells consists from basophils. And these cells produced inflammatory factors. It means factors which stimulate additionally all processes of reaction on inflammation. Reaction produced when basophils release in blood substances like heparin, histamine, and serotonin. With help of these factors, especially histamine, realized 5 main effects of inflammation. In Latin language, they named color, rubor, tumor, dolor, and functio lesa. It means reddish with increasing blood supply for inflammatory region. And with help of blood, neutrophils came into this region. Rubor, it's reddish color, it's increasing temperature, because with blood, our tissues became warmer, and we may feel that in the region of inflammation, temperature slightly increased. Tumor, it's increased volume of region, again after came an additional amount of blood, plasma from this blood transfer through vessels walls and came into tissues for start tumor. As a result of tumor, frequently we may feel pain. It's door effect, because pain usually it's a result of mechanical stimulation by tumor and chemical stimulation of receptors in our tissues. Chemical stimulation realized mostly with heparin and histamine. That's why in region of inflammation we may feel pain, and this pain lead to decreasing activity, functio lesa. When we feel pain, we didn't use this region in our daily activity. And this decrease in activity lead to faster recovering, easily stopped inflammation without any excessive physical activity. Usually, basophils work together with eosinophils. This pair help to each other because eosinophils have many effects. Some effects associated with their own immunic functions. Eosinophils may stop activity of parasites like worms. They may destroy some inflammatory proteins, especially when they associate together antibody and antigen proteins from foreign proteins. They named usually antigen, and they may associate with our own gamma globulins and blood antibodies. But this association may start clot formation, and for preventing this, eosinophils worked very well. And additional very important function for eosinophils, it's breaking down of histamine. With help of histaminase, eosinophils are breaking down histamine which produced by basophils. And this is highly important. That's why I say basophils and eosinophils work together. Because if basophils increase the activity, inflammation became very strong and may lead to damage our own tissues. And with help of eosinophils, our immune system regulate intensity of immune response. Next type of white blood cells, it's monocytes. And monocytes, it's biggest cells in our white blood cells in our immune system. The diameter may be twice more compared to other white blood cells, more than 10 micrometers, and usually it may be 12 or 15 micrometers and even more. And total amount of monocytes, not very large, it's about 8 to 10%. But monocytes are used for early recognition of invasion. When viruses, bacteria came in our body, they usually came through barriers, like our skin is barrier for bacteria, our mouth, our stomach, our intestine. All these organs have their own barriers which prevent for easily came bacteria in our blood. But in many cases, especially after mechanical damage and after bleeding, these barriers may be blocked, and bacteria came into our blood. For monocytes, it's very typical placement in these organs. And monocytes usually don't spend many time in blood. After came from bone marrow, monocytes usually placed less than 1 day in blood, and after this period, monocytes came into skin, into mouth, into stomach, into other organs, and catch bacteria for early recognition. In organs, monocytes transformate into other type of cells to macrophages. Macrophages, it's next staging of growing for monocytes. That's why in blood we tell about monocytes, in tissues we tell about macrophages, but it's same cells. And macrophages can catch bacteria and after catching destroy with recognized some specific receptors on surface for these bacteria. You may find in this picture recognition take place and lead to producing some activatory factors which produced by macrophages. It's interleukins, tumor necrosis factor, and main histological complex MHC class 2. It's a type of protein which traveling in blood with help of blood alive and associated with neutrophils, activate neutrophils. So without this specific realizing effect between macrophages producing complex of MHC protein and receptors from bacteria. Next step, after this complex protein and receptor from bacteria came to neutrophils, activate them, came to lymphocytes, activate them, and as a result, macrophages activate all our immune system. Activation of neutrophils lead to non-specific resistance, and activated neutrophils try to eat in all bacteria, all foreign cells. When macrophages activate last type of white blood cells, lymphocytes, this leads to other kind of response, they named specific response. And specific property for lymphocytes, it's recognition only one antigen, only one type of virus or bacteria, recognize them and react only with this type of antigen. Lymphocytes divide on several groups. Usually we talk about T lymphocytes, B lymphocytes, and natural killers. All these subtypes, lymphocytes, mostly recognized and destroy viruses. Its first specificity, because neutrophils, eosinophils, basophils, all other white blood cells could not fight with viruses, but lymphocytes can do this. Next specificity, as I told you previously, lymphocytes can detect only one kind of antigens, for example, one kind of viruses. And when activation happens, lymphocytes easily detect this specific type of virus in all our tissues, in our blood, and fastly destroy this specific type of virus. For activation, lymphocytes need signals from monocytes, which virus came in this moment in our blood, and which virus we should recognize and destroy. This reaction may look like in next slide. You may find a chain of reactions. First of all, macrophages catch antigen, virus, bacteria, protein, and produced complex of their own protein MHC class 2 with receptor from antigen. This complex lead to activation lymphocytes and activation of lymphocytes lead to recognition which kind of viruses came in blood. Activated lymphocytes came to all our regions in all our blood and produce secondary activation. Now, not macrophages, but activated lymphocytes produced activation of other lymphocytes. Those lymphocytes which can receive signal from monocytes, macrophages, and transfer this signal to other monocytes, to other lymphocytes, sorry, named T helper. Usually it's only cells which help for transferring signal, but these lymphocytes did not work like killers. They did not destroy viruses or other antigens. But activation of T killers as a result may lead to producing by killers type of reaction when lymphocytes named T killers can destroy viruses. For recognition specific types of viruses, lymphocytes have many receptors on surface. You may find in this picture there is a huge amount of receptors for reactions with macrophages, for reaction with T helpers, and for reaction with viruses. Without all these receptors, lymphocytes could not work properly. And normally, only those lymphocytes which have all necessary receptors came into blood and work like immunic cells. T lymphocytes realized cell-mediated immunity. What it means? When T helper activate by macrophage, this T helper activate T killers, and these killers can kill antibodies, antigens, with some specific mechanisms. Usually it's chemokines, cytokines, and other proteins which placed on membrane of T killer and contact with other cells lead to destroy these cells. B lymphocytes again work like immunic cells, but they realized other type of immunity. They named humoral immunity, and humoral it means Latin word humor, which means liquor, because B lymphocytes produced many immunic proteins. Other name it's gamma globulins or immunoglobulins, and with help of these immunic proteins, B lymphocytes directly destroy antigens. After activation by T helper, B lymphocytes convert into plasma cells. What it means? Plasma cells, it's activated B lymphocyte which can produce a specific reaction. Reaction of synthesing only one type of proteins. Normally, all cells may produce proteins, different proteins for growing, for dividing, for metabolic activity. But activated B lymphocyte produced huge amount of only one type of protein, only one type of immunoglobulin. And this immunoglobulin specific for catching and attaching to only one type of antigen. For example, to only one type of virus. HIV virus, coronavirus, any type of virus have their own specific immunoglobulins, and when B lymphocyte produced immunoglobulin for reaction and neutralizing this specific type of virus, B lymphocyte named plasmatic cell. Usually, work like plasmatic cell is very effective because these plasmatic cells may clone, they may produce several identical cells, and each of them produced many immunoglobulins. And all these immunoglobulins easily traveling with blood protein molecules. It's smaller compared to cells and may easily detect and destroy antigens. But after stop immune response, viruses is finished, we destroy all these viruses. Most amount of B lymphocytes destroy or convert from plasmatic cell back to B lymphocytes. But a small amount of B lymphocytes after every infection, after every activation, stay in some specific form which named memory B cell. What it means? These cells don't produce like plasmatic cell many immunoglobulins, but these cells don't activate it by monocytes. They already have receptors to viruses. They already have information which type of virus they previously detect. And if this virus again came in blood, for example, they didn't activate monocytes, macrophages, a virus like a spy came directly in blood, and meeting with memory B cells, these cells instantly produced huge amount of immunoglobulins and need to destroy virus. So memory B cells need for early reaction for next version of same type of virus. That's why many infections in second, in third time became easily. We have memory cells and next infection, especially if it's viruses infection. Next time lead to a fast immune response. This funny pictures are used for easily memorizing all what I say previously. You should memorize role of different subtypes of lymphocytes, T and B lymphocytes, and role of activation process when T helpers receive signal from macrophage, they activate T killers, they activate B lymphocytes, and activated cells lead to immune response. For activation, we need time. That's why immune response usually require many time. For neutrophils, previously I told you it's about 1 day. For a specific immunity, for activation of T and B lymphocytes, we need much more time, from 1 to 7 days. You may find in this picture a peak reaction of immune response start only after 1 week. And for example, again, in nowadays, infection in coronavirus, we say that immunization did not produce instant reaction. Even if you receive vaccine, from 1 day to from 1 week to 1 month, you need time for increased efficiency of your own immunity. If infection came before peak of immune response, in first, second day, for example. Your body did not ready for good resistance to invasion, and disease may destroy your body and your tissues. In general, all reactions of our immune system have specific time lag. You may find in this picture. For non-specific immune response, it's faster start but faster stop. Neutrophils easily destroy bacterial cells, but as a result of this destroying, neutrophils may break down, and as a result, they stop their own activity. Macrophages, T lymphocytes, and especially B lymphocytes require more time, as I said previously, from 1 to 7 days, and in some cases even more. But as a result, reaction is more constant, and immune response with help of memory B lymphocytes, with help of macrophages, immune response may be more stable. Terms of stability for immune response associate with next idea about active and passive immunity. You know, our body may increase immune response, for example, after contact with antigens with coronavirus infection, but it's very dangerous, and this infection may lead to death. That's why we need a way for preparing our immune system for better recognition and better, faster destroy virus. And we have two ways. First way, named active immunity, when we activating our lymphocytes before infection take place. Usually for activation, we used same receptors from surface of virus, like macrophages do. But we give not virus, but only part of virus, only specific receptors. We destroy virus, catch this receptor, and give this receptor to macrophages. Macrophages send signal to T helpers. T helpers send signal to B lymphocytes, and B lymphocytes convert to B memory cells. And after this immune response, it's quite long period, many days, but after this activation happen, B lymphocytes, memory B lymphocytes, produced fast response when infection happened, when real virus came in our body. And this is aim for many vaccines. And for example, vaccine from coronavirus work with similar way. But in some cases, we have no time. We could not wait many days or weeks for activation our active immunity. In these cases, we have passive immunity, and passive immunity is placement of immunoglobulins, proteins which normally produced by our B lymphocytes and plasmatic cells. But we don't wait when our B lymphocytes convert to plasmatic cells. We take from other person this immunoglobulins and placed in blood of donor or recipient. As a result of passive immunity, instantly increased ability for destroying viruses with help of immunoglobulins. These proteins may detect and break down viruses in blood of patient. But this passive immunity, it's not lasting a very long period of time. And after several months, these immunoglobulins destroy and immune response is decreased. Passive immunity, for example, take place in newborns when baby receive immunoglobulins from mother's blood and especially from mother's milk. Because in breast milk there are many immunoglobulins. That's why children which eating this breast milk realized passive immunization and immunity quite strong during all this period. When baby stop eating milk, breast milk, immune response decreased and some viruses attack baby's body. A second example of immunization, passive immunization, it's traveling. When you came to other country, but for short period of time, you may receive not vaccine, but passive vaccine. They did not have parts of viruses, receptors of viruses, but they have a large amount of immunoglobulins. And during several days, weeks, even months, these immunoglobulins may help you resist to infections in other country, in other region. But after this time, immunization is finished and you need before stop protection came back, or you may increase risk for diseases. Our immune system, our white blood cells regulate the activity and speed of their maturation. And for this regulation, we have several organs in our body. First of all, it's bone marrow, where white blood cells and red blood cells produced. But after producing white blood cells, came to other regions. First of all, it's thymus. It's gland which placed in our neck, and thymus used for maturation of white blood cells. Maturation realized in placement receptors on surface of white blood cells. It's T lymphocytes, and only those T lymphocytes which have receptors for foreign viruses, proteins, for antigens, and receptors for our own tissues. Lymphocytes should know that this cell is good cell and those cell is bad cell. For this recognition, we have two types of receptors, and only those T lymphocytes which have both kinds of receptors for detection good and bad cells. It's adult lymphocyte and may came from thymus into bloodstream. If T lymphocytes have no receptors, any kind of receptor. They destroy in thymus. That's why maturation usually associated with checking up quality of lymphocytes. And only good lymphocytes, which can easily detect as infection as our normal cells, for protect these cells, convert to adult lymphocytes. For B lymphocytes, maturation takes place by same way, but in different regions. It's mostly bone marrow and lymphatic nodes. These lymphatic nodes, maturation of B lymphocytes take place again for good recognition of antigens. Normally, intensity of maturation very high in children, but decreasing with ages. After 60 years old, maturation of lymphocytes is stopped, and old persons have very weak ability for specific immune response. In children's, maturation of white blood cells came with specific periods. You may find in this slide in 5 days after birth, dramatically increased amount of lymphocytes in baby's blood, and it need for a faster increase in activity of immune system and faster maturation growing lymphocytes. Baby's body produced much more amount of these lymphocytes, but process of maturation for lymphocytes, speed of this maturation decreased after 5 years old. And it's highly important for diagnostic, because in adults, if you find, for example, neutropenia, decreased level of neutrophils, and lymphocytosis, increased amount of lymphocytes, it's a signal of acute virus infection. It's not good. But in children between 5 days and 5 years, it's normal. In this period, immune system produced less amount of neutrophils. That's why children frequently catch bacterial infections, and increased amount of lymphocytes for fast immunization, for fast maturation, and leukocytosis in this period is normal. It's not pathology. Even during day, our immune system change the activity, because process of mobilization for monocytes mostly take place at night, and we need good sleep not only for restoration for our brain and muscles, but for restoration of our immune system. During night period, traveling of immune cells increased, and during daily activity, clearance, destroy of all infections may increase. Okay, next type of formed elements in our blood, it's platelets. And platelets, it's parts of the cells, it's not complete cells. These parts include only cell membrane and cytoplasm with many vesicles. Total amount of platelets in our blood, you may find it's about 180 to 320 in 10 power 9 in 1 liter. And platelets are highly important for other function. They mostly realized hemostasis. Situation when we need to stop bleeding after damage of the vessels, for example. And in this stopping bleeding, important role play platelets. But in general, we have several steps and several stages for hemostasis. First of all, you may find in this picture, after damaging of vessel, this damage produced platelet activation. It means from platelets, from vesicles and platelets, many enzymes came and this named activation. After this activation happened, platelets easily attach to each other and together form platelet plug. This process is quite slow. They require about 5 minutes. But after platelet plug formation, bleeding may stop if it's bleeding from small vessels. If damaging takes place in large diameter vessels and arterial pressure or pressure in vessel is high, platelet plug don't have a chance for formation. All activated platelets move out from a vessel with high speed of bleeding. That's why in large diameter vessels, platelet plug formation combined together with coagulation. Coagulation, it's a process of conversion water-soluble proteins like fibrinogen in water-insoluble proteins like fibrin. And water-insoluble proteins lead to convert liquid, our plasma, into gel. This gel stop bleeding and lead to clot formation. Why we talk about coagulation cascade? You may find in this picture it's many reactions which came together, and these reactions, it's chain reaction, when next stage lead to additional activation for previous stage, and as a result, speed of activation increased and increased and increased. And as a result, all fibrinogen in plasma instantly in one moment convert to fibrin. That's why bleeding may stop even from large diameter vessel. And hemostasis in our body associate with next reaction, fibrinolysis. Actually, after clot formation finished, stop destroying of this clot. This destroying named fibrinolysis. As this reaction quite slow, they may require several days, not few minutes. But fibrinolysis is highly important for restoration of blood supply, because our tissues need nutrition, need oxygen, and after stop bleeding, vessels should recover and again transfer oxygen and nutrition to all regions and cells. Platelet plaque formation have several stages. Usually, first stage activation associated with granulation of vesicles and entering enzymes from vesicles into plasma, into blood. Most important, it's ADP, adenosine diphosphate, which start process of platelet plaque formation. But additionally, there is huge amount of other substances in platelets like serotonin, thromboxane. These substances lead to faster attaching platelets to each other. And formation of common plaque, which after formation start contraction. Again, it's realized with help of many enzymes like serotonin, ADP, means, and decreased size of damaging in vessel, decreased bleeding. Clot formation, like previously I told you, it's many reactions, it's cascade of reactions. Usually these reactions start together with platelet plaque, but in small vessels, clot formation did not work very well because this cascade of reaction require more time comparing to platelet plaque formation. This reaction may require several minutes, usually up to 6 minutes. That's why this reaction worked very well only in large diameter vessels in which platelet plaque formation non-effective. And even after clot formation takes place, they need additional time, 20 hours and even 20 minutes and even up to 1 hour. Clot contract for stop bleeding, and again it's require many additional time. You may find in this picture main reactions which associate with coagulation cascade, with formation of a clot. And coagulation cascade consists from many reactions. In every next reaction produced more and more enzymes. That's why they named cascade, for provide in very fast, in one moment, activation of proton binase. With help of proton binase, activation of thrombin take place, and with thrombin, activation of fibrin. Preparing to this reaction is quite slow. As I told you previously, they require several minutes, but last reactions of this cascade is very fast, instantly. Preparing reactions divide on two ways. Preparing reactions divide in intrinsic and extrinsic ways. Why we need two ways? Look on this slide. First of all, extrinsic way is quite fast. They require only several factors. Factor of Stewart-Powers, factor 12, factor anti-hemophilic globulin A, and factor of Hageman. But this way produced a small amount of prothrombinase. It's very weak reaction. When prothrombinase take place, they lead to increasing speed of intrinsic way. It's more powerful way, they require more time, but as a result, we produced again prothrombinase, but after many reactions. Activation of anti-hemophilic globulin C, anti-hemophilic globulin B, anti-hemophilic globulin A, and so on. All these long-time reactions produced much more prothrombinase. So this intrinsic way is more powerful, but they could not work normally without extrinsic way. And to these ways of clot formation need for work together. Only combination is very effective. If due to some problems, usually it's genetical diseases, person have deficit of some ways, usually deficit of intrinsic way, deficit of factor 9, factor 8, lead to diseases which named hemophilia when extrinsic way is very weak and did not enough for good coagulation. The person suffer from bleeding, they don't stop, and person even may die from bleeding without a normal activity of intrinsic way. Abnormal increasing activity of intrinsic way, again, it's not good, and activation of this way due to atherosclerosis, due to inflammations, may lead to clot formation without damaging of vessels, and in many cases it's situation which lead to ischemia, to stroke, and may lead to death. That's why normally we need both ways for coagulation cascade, and only together they give good ability for stopping bleeding, and adequate stopping bleeding only in situations when this reaction is highly important. Next step, as I said previously, after clot formation happened and fibrin produced its main component of clot, fibrin, it's protein which catalyzed increasing speed of next reactions of fibrinolysis. Fibrin stimulate their own destroying, and this is highly important for normalizing permeability of vessels. This destroying named fibrinolysis, normally it's a very slow process. We need time for recovering vessels. And as a result, degradation of fibrin take place, destroying of molecule fibrin. But process of fibrinolysis may regulate by some external and internal factors. We have internal factors which regulate and increase speed of fibrinolysis with help of plasminogen, plasmin. It's molecules which produced after fibrin degradation, and as a result, speed of fibrinolysis increased and increased and increased. But additionally, we have external factors for regulation speed of fibrinolysis, and such enzymes like plasminogen activator, urokinase, streptokinase, they may lead dramatically increased speed of fibrinolysis. And this may be as pathological process, for example, streptokinase, it's toxin which produced by streptococcus, and during streptococcus infection, patient may suffer from bleeding because clots very fast destroying and bleeding repeat again and again and again. But it may be very good for medicine, because in situation when clot lead to stroke, for example, with enzymes like urokinase, which increase in speed of fibrinolysis, we may very quickly destroy this clot. And in nowadays, very effective curing for clotting in brain, in heart, it's injection of urokinase, which may dissolve clot, but only in first hours after clot formation. And if a person receive this injection in first time, he may completely recover and even didn't suffer from stroke. In general, today I told you about functions of different type blood cells, immunic cells, specificity of these immunic cells. I told you about process of coagulation, role of platelets in coagulation, role of cascade in coagulation, and role of next step of fibrinolysis for balance between clot formation and clot dissolving. That's all for today. Thank you. And again, if you have some questions, you may ask me.